Is the CEA tumor marker test enough for colon cancer diagnosis? The CEA tumor marker test is often discussed in the context of colon cancer, but is it enough for diagnosis? Let's dive into this important topic. The carcinoembryonic antigen test measures levels of a specific protein that can be elevated in some cancers, including colon cancer. However, it is crucial to understand that this test alone is not sufficient for diagnosing colon cancer. One of the main reasons is that the sensitivity and specificity of the CEA test are limited, especially for early detection. Studies show that only about 25% of colorectal cancers produce high enough levels of CEA to be detected a year before clinical diagnosis. This means many early-stage cancers could be missed if we relying solely on this test. Additionally, elevated CEA levels can occur in non-cancerous conditions, leading to false positives. For example, smokers often have higher CEA levels, which complicates the interpretation of results. While the CEA test is not suitable for initial diagnosis, it plays a valuable role in monitoring patients after treatment. Serial measurements of CEA can help detect recurrence, particularly in cases where the cancer has spread to the liver. The test has moderate sensitivity and specificity for this purpose, providing a lead time of several months before clinical signs of recurrence appear. It's also important to note that the CEA test is not recommended as a screening tool for asymptomatic individuals or those at average risk for colon cancer. More effective screening methods include colonoscopy and fecal-based tests, like the fecal immunochemical test or Cologuard. These methods have proven to be more reliable for early detection of colon cancer. Combining the CEA test with other tumor markers can improve diagnostic sensitivity, but it still cannot replace the need for imaging studies and tissue biopsies for a definitive diagnosis. Factors such as smoking and certain benign conditions can affect CEA levels, further limiting its reliability as a standalone diagnostic tool. In summary, while the CEA tumor marker test is valuable for monitoring colon cancer progression and recurrence, it is not enough on its own to diagnose colon cancer. A comprehensive evaluation by healthcare professionals, including clinical assessments, imaging studies, and endoscopic examinations, is essential for accurate diagnosis. If you have concerns about colon cancer, it is always best to consult with your healthcare provider for personalized advice and evaluation.